All right, everybody. Thank you so much. Can you guys hear me okay over there? I know it's okay. Great. We appreciate so much all of you coming out. I know, and as many meetings I go to at the city, I did not know there was a parade going on Main Street right now. So I am so sorry about that. So I'm sure that pulled some, but just so that you're all aware, here at the hospital, we are now under our emergency response level, which is orange. And so for that purpose, we've downscaled this tremendously. And so as much social distancing as we can do, we appreciate that. We appreciate so much all of those who are here with us, many of the dignitaries, and we'll announce in just a few minutes. But I would just like you all to know how much we appreciate your coming here today. We would first like to have Dr. Rachel Gonzalez, our Chief Executive Officer. She's going to give just a short message here. Following Dr. Gonzalez, we're going to have Kevin McEwen. He'll do a little bit of an introductions for some of those who are here, and then also give us a little bit of an overview of this unit. So we'll turn the time over to Dr. Gonzalez.
All right, can you hear me okay? Got it? Okay. Is it morning? What time is it? It's afternoon. Is it afternoon? It's noon. Okay, good afternoon. You know. Okay, better? Yes. Okay, all right. All right, come on up. This is like the one time if you have your mask on that you cannot physically distance on this property, okay? Thank you guys for coming. We are outside of having our masks on. We are not talking about, the pandemic or anything at this moment. Right now, what we're going to have the conversation about, and our, esteemed guests are going to go into details about this, is mental health. And I have to tell you that honestly, everybody here should be so proud of this moment. I'm sorry that we're not inside showing you this at the moment. I'm sorry this is not the party that it should be. But everybody should be so, so, so grateful that we're at a pivotal moment in our community, recognizing the dire need that we have for this service. We are truly having the conversation, sorry, I keep pulling it further away. We are truly having the conversations of the need in our community to help each other on mental wellness. And, I have been here not as long as some, like Alan, just teasing Alan, but over the years, there was times when we didn't even want to talk about this. This isn't a conversation that we want to have. We don't want to acknowledge that we have some of these issues in our communities or with our loved ones. And we're here today to say, yes, we do. But yes, we're here for you. And I have to tell you that I almost want to cry over this. Yes, I cry a lot at these. Primarily because we have had such significant support from the community, from everyone on being willing to address this issue so we can be here for everyone. So I wanted to just say thank you. Thank you for this cause, and thank you to, I could go through a long list, but then you get really bored, but I got to do just a couple quick shout outs. If we didn't have JRW helping us build this, we wouldn't have the building. If we didn't have the University of Utah helping us by giving us their doctors, just kidding, well, not really, by helping us set up the protocols. If we didn't have all the staff willing to help care for these patients, I could go through this, BYU, the county commissioners, I'll let Kevin kind of go through this, but we didn't have to plead for help, it was there. That means that people are committed to this. So I just want to say thank you to everyone. And when you leave here, just feel proud. Feel proud that we've got a great community. Feel proud that we're here for people who need this service. And with that, I really want to turn the time over to Dr. Kevin McEwen. He just got his doctorate this year, so it's kind of awesome.
She's overusing that title.
He really has, and we could not have done this without him. And I thank you so much for carrying this weight when I've been playing and doing some other things. He's carried this ball, this really big ball. So thank you, Kevin. I appreciate it. And it's his turn.
Thank you. I was really afraid she was going to kiss me on camera. And somehow the crisis standards of camera go out the window of what we're doing here at Madison Memorial. But it is a thrill. I'm the Chief Nursing Officer here at Madison, and I've been the project lead for this behavioral health unit, and it is a fantastic opportunity for us to care for each other and to take care of this vulnerable population. This project really has taken a course over several years as we have recognized this community need, and as we were seeing hundreds of patients every year having to leave our organization and our county to receive these services. And so as we approached our county commissioners and our board of trustees and asked for permission to look at providing these services at Madison Memorial, as Rachel said, at every turn their commitment was yes, please. There were very few pauses of, are you sure you want to do this? Now, as we've gotten into this project, we've said to ourselves, do we really want to do this? And as we've talked to our community leaders and others, they've said, wow, this is a big undertaking, are you sure? And once again, I've gone back to our leadership, and they have said, yes, we need to do this. We engaged very quickly with the University of Utah Hospital and their University Neuroscience Institute that is now the Huntsville Mental Health Mental Health Institute. I can never get it right. I don't even get the acronym right. So, but it's not even on here. So the Huntsville Mental Health Institute. Yeah. We struggle with it. I know. It kind of just goes off your tongues now. So you say it like 30 times a day, probably before you get to work. But really a lot of support in this project from the construction pieces of how to take over an existing space. This was a space within our hospital that was highly utilized almost every night with our sleep clinic and overflow with our moms and babies that happens here regularly like today. And we took over this space and were able to construct a 12-bed adult behavioral health unit, which is much needed in our community. We have some great community partners in Idaho Falls with ERMAC and the Behavioral Health Center there, and our friends in Bingham who also have a mental health unit, and really have strategized with what is the community need, and that really came down to adults that need to stay in our community. It's a 12-bed unit, as you will have a chance to tour. Some of them are private, some of them are single. That's not by choice, but by decision as to who gets which. But it's a wonderful space. We hope you find it very healing, very calming, a place that we can truly care for each other. And this may be the only unit in the entire state of Idaho that is fully staffed. As you know what's going on, and the fact that we were able to recruit Dr. Morris and Dr. McCoy, also a unit within the state of Idaho that has 2 dedicated psychiatrists that are specially trained in adult inpatient care, is quite an exceptional thing. And then to have fully staffed social workers and nurses and psych techs and unit clerks is pretty exceptional. I think a couple months ago we were pretty sure that the construction would end, but we weren't sure we'd be able to staff it. I think we joked for a while. It's like, okay, if we open on a Monday, we can keep it staffed till Thursday. And yet we have, hopefully you get a chance to touch base with some of these folks that are in scrubs. These are many of our staff that are here, and our social workers. These are folks that have a passion for caring for their neighbors, friends, and relatives. And some of them have worked in psychiatric care for years. Some of them have never set foot in one of these units when it's been open, and we'll see how that goes on Monday, right? So, but they're really passionate about caring for the mental health neighbors, friends, and relatives, and that's what we do here at Madison. Everybody who steps in our doors is a neighbor, a friend, or a relative, of almost always us, and if not us, then somebody else. And we treat them, every patient, every time, with that level of compassion to make sure that they're getting the needs they need. So without further ado, if I tried to list anybody, I would miss half of you, but really happy to get to this day, and we're happy to show off a little bit of what this team has put together over the last many, many years working on this project together. So thank you very much.
We've got some great staff. It's wonderful. Let's, we appreciate our chamber who is here. This is a special thing. We appreciate so much they're coming out. So we'll turn the time over. You got a second? You want to come up here? And
Sure.
we got our chamber president here, and we appreciate Chris Mann so much. And so we'll turn the time over to him, and then we'll kind of follow his direction on the ribbon cutting.
Thank you. We were just a little bit late. We left 35 minutes early, and Janine kept saying, Chris, call Doug, tell him we're going to be late. I go, just keep driving, Janine. Don't forget that stop sign, just drive right through it. But we are so proud of Madison Memorial Hospital. I talked to an agent, a real estate agent last week, and she said, when people come here, they want 2 questions answered. And it's not about weather. It's not about this or that kind of a community. It's number 1, tell me about the school district, and number 2, tell me about medical care. And so this is an important element to the growth of Rexburg, that this hospital has been able to keep up with the growth and provide the great care we have here in this community. And we're so proud of this new wing. We all know how important it is, and we thank the Madison Memorial community and the commissioners and those who make this possible, because without good health care, this community could not exist at the level it does. And we have homecoming parade, there's a great school district, and we have a great hospital. So that's why this community grows. So Brandon Ty is the chairman for this year. Brandon, if you want to kind of coordinate the ribbon cutting, we'll be glad to do that.
You ready?
Wait.
On 3, you ready? 1, 2, 3.
Again, we thank you so much. There's a lot of swag, some waters and things like that. We'll open up these doors and you're welcome to take a tour. Again, if we can, as much distance as a teeny bit, but we're here to answer any questions that you have. The folks from our media, thank you so much for being here, and we'll get anybody you'd like interviews with.
I like it. No, I like it a lot. You should have done it.